Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order and it is quite convenient for the study. We have been discussing about approach to a child with developmental delay. Of course, my dear friends, we have discussed this topic in many parts. So today we will have the continued portion of the same. Okay, there are certain causes which should not be missed at the primary care level. Whenever a primary care pediatrician examines the patient, there are certain things that should not be missed. As we know, one of the most important thing is hearing loss. So hearing loss, you should identify it as early as possible. Okay, so therefore, nowadays we follow the universal newborn hearing system assessment. Okay, so that's assessment system is there. Similarly, the vision that should be identified. That means if the vision problem is there, that should be identified at the earliest, because earlier the diagnosis, better will be the prognosis and also the treatment. What I mean to say is one more very important thing that should not be missed at the time of the birth or thereafter, that is hypothyroidism. Hypothyroidism is considered as one of the preventable cause of mental retardation. So therefore, we have got only few causes where the mental retardation can be prevented, which is very dreadful and harmful, and one of them is a hypothyroidism. Okay, so universal newborn thyroid screening is also done, and thyroid function test should be also done immediately after the birth as per the schedule. There are some nutritional causes which leads to developmental delay, and that should not be also missed. For example, iron deficiency anemia, maybe vitamin D deficiencies, vitamin B12 deficiencies, or some of the other fatty acid deficiencies, etc., which may lead to the developmental delay, which are attributed to nutritional causes. So these four should not be missed by a primary at the primary care level. Okay, now let us discuss about this case. The things will be very clear here. A 11-month-old baby girl who is brought with the concern that she is not sitting and not speaking. Height is 56 centimeter and upper segment and lower segment ratio is 1.332:1. There is an umbilical hernia and also it is associated with the constipation. TSH level was done, it was increased 66 and free T4 level is 0.3 milligrams. Now thyroid scan is also done. And there is no evidence of functioning of the thyroid tissues. That means there is functioning thyroid tissues are absent. So therefore this is a case of probably thyroid agenesis of the thyroid. See, when it is picked up, 11-month-old baby, child is 11-month-old. So child was treated according to the hypothyroidism. It is considered as congenital hypothyroidism. A neonatal thyroid scan would have been pick up this hypothyroidism earlier. Of course, here it is picked up, but at the age of 11th month. But a neonatal thyroid scan, if it is done at the early part of the life, maybe in 15 days or 10 days, then same problem would have been picked up at the age of 10 or 15 days and better treatment is possible. Similarly, we have got another important case. Let us see. A 1-year-old, 5-month-old baby, 1 year and 5 months, that means about 17 months, came with the concern that she is not walking. He is not walking with support. And when you take the history, the perinatal period was uneventful. There is no any uneventful history. He presently waves bye-bye and he also talks some of the kinship words, and otherwise child is neurologically normal. Now presently when it is examined, there is a mild wrist widening. And at present, 1-year-old and 5 months, at present there is no particular bowing of the legs, but wider wrist is seen. On investigation, the vitamin D is 6.2 and calcium is normal. X-ray shows no such evidence of rickets at present. Now, mild symptoms, that is X-ray is showing some mild presentations related to the ricket, but not absolutely. So this is now vitamin D deficiency. This can be an important cause for the isolated motor delay. If here the child is coming with the not able to sit with the support, okay, not able to walk, etc. So this is under the motor milestones. So a vitamin D deficiency also manifests sometimes as a motor delay, gross motor delay. So if you are able to identify or find out, pick up this case at the earlier, again, the treatment would have been better. Now similarly, we have got another important case. That is two siblings are there, 5 years and 7 years old. I think we will discuss this case in the next part. Thank you very much for your patience listening. Thank you very much. Please do subscribe to my channel, and also please give your valuable comments.